Hello, and welcome to the American Medical Association's Climate Change webinar series. This is the second of a three-part series that we are organizing over the coming months, and today we will be focusing on climate resiliency in the healthcare sector. I'm Dr. Ilse Levin, a member of the American Medical Association's Board of Trustees. I'm a board-certified internist, epidemiologist, and a hospital-based physician for the Mid-Atlantic Permanente Medical Group in the DC Southern Maryland region. Before we begin, I want to thank you for the questions submitted during registration. You can also join the discussion and submit questions at any point during the webinar by joining the chat. We will get to as many questions as we can during our discussion. I'm delighted to be here today to take part in this critical discussion about how we in healthcare can build resiliency in the face of the numerous threats posed by climate change. But what do we mean by the term climate resilience? As we discussed in our first webinar, with increased global temperatures, we are witnessing more frequent and severe weather, including drought, hurricanes, extreme temperatures, and heavier rain events that lead to flooding. The recent and tragic floods that devastated communities in Texas, New Jersey, and New York are just a few examples. Our ability to prepare for, recover from, and adapt to these more severe and frequent weather events is called climate resilience. While climate resilience efforts are not going to look the same at every hospital or even within the same health system, one thing remains consistent. Health systems are critical facilities that need to continue their operations in the face of potential disruptions in power or transportation systems, or in the event of extreme weather. And being prepared can not only help save money, but also save lives. Therefore, it is imperative that healthcare systems anticipate and mitigate the impacts from climate change, which is why I'm excited for today's conversation. I'll introduce our esteemed guests, each of them working in resilience and sustainability at their respective healthcare system. And then we'll move into a Q&A session to address your questions. First, I'd like to welcome Kyle Tafuri, the Vice President of Sustainability at Hackensack Meridian Health. He leads the creation of corporate sustainability in areas including infrastructure upgrades for energy efficiency, on-site renewables, green building, sustainable food, waste reduction, purchasing, and safer chemicals. Over the past 12 years, Mr. Tafuri has made sustainability a part of Hackensack Meridian Health's DNA. Hackensack Meridian Health was the first health system in the country to achieve the Joint Commission Sustainability Certification, and Hackensack University Medical Center has been recognized by Practice Green Health as a top 25 hospital for 10 years in a row. Second, we'll hear from Aminul Haque, who is the construction project manager at New York City Health and Hospitals Corporation, the largest municipal healthcare system in the U.S., where he leads projects focused on making healthcare facilities more resilient in the face of climate change and severe weather. With hands-on experience managing the design and construction of resilient and redundant systems, Mr. Haque has worked on major initiatives including a flood wall at Metropolitan Hospital, Hurricane Ida recovery and mitigation efforts at several hospitals, and critical COVID response upgrades. And last but certainly not least, we are joined by Rachelle Wenger, who is the System Vice President of Public Policy and Advocacy Engagement for CommonSpirit Health, one of the largest not-for-profit healthcare systems in the nation. In this role, Ms. Wenger is responsible for advancing the organization's public policy priorities with a focus on social and environmental determinants of health, such as housing and homelessness, climate change, nutrition and food systems, immigration, human trafficking, and violence prevention. An integral member of CommonSpirit's Climate Action Plan core team, she also oversees the implementation of the Climate Resilient Communities Pillar as the organization works to meet its net zero goal by 2040. Full bios for all our speakers are available on the event registration page. We're very excited to have all of you here with us today, so let's get started. First, we'll hear from Kyle at Hackensack Meridian Health.
Perfect. Thank you for that introduction. So Hackensack Meridian Health, we're 18 hospital system based in New Jersey, close to 40,000 team members. my first day was actually the day of Hurricane Sandy was my first day at Hackensack. So I was welcomed into this world in a fun way, you could say. But so we have hospitals through up and down New Jersey, a lot of them on the coast. So we experience flooding and all of that um, during many of these extreme weather events. But when I talk about resiliency, I think there's a number of different um, avenues that you can speak about it. And, I don't think it just has to be when it comes to extreme weather. I think a lot of what we learn from other types of um, things, like whether it's COVID pandemic or all these different areas, I think there's pieces that we can take and bundle into our overall resiliency program. So when we look at resiliency, I'm going to give a couple examples from a few different components of what we do, and you'll hear a lot more from the infrastructure when we get to Aminul. But from a facilities lens, one example is, Riverview Medical Center, one of our hospitals located on the Navesink River during Hurricane Sandy, was hit with some strong flooding. So after that, we partnered with the community and we installed a flood wall at the hospital so that where the water had gone in previously when it would flood, now we had that flood wall barrier there protecting our critical infrastructure. So, that's an example of one single hospital, but a theme that hopefully you're going to hear from without is around collaboration in these areas. So another aspect of facilities that we've partnered on is we've partnered with our utilities. As anyone here that works in health systems can know, when it comes to capital for infrastructure, it's never really going to beat out the MRI or the robot for the ORs or all these different areas. So we had to get creative, and we partnered with our utilities to help us fund infrastructure upgrades, predominantly around reducing our energy footprint. But in doing these upgrades, we're also able to upgrade crucial infrastructure equipment, which really lends to that resiliency standpoint because we have the latest and greatest technologies. Whether it's we're upgrading our chillers and boilers, air handlers, also looking at our generators, obviously. But in partnering with these utilities, I think it was a very important piece because we said, there's a lot that we want to do when it comes to resiliency and energy work, but we're limited in the capital that we had. So to date, we've actually been able to invest well over $100 million through our utilities without ever having to outlay capital. So we repay back this. A portion of it, about 50 to 60% of that, was in the form of a grant, so we don't have to pay it back at all. And then the other 40% was paid back through zero financing through our bills, our energy bills. So that was a big piece. But one of the things that we said to the utilities was, hey, we've done a lot of this basic infrastructure work, which has helped bolstered up our resiliency and being able to operate our hospitals, whether it's during heat waves, different areas. But how do we, get to that next level? So an example of something that we're working on now, because I don't just want to go through these successes, but just offer an area that any institution can pursue, is we partner with our utilities about looking at installing a geothermal system that would not only deliver energy to our hospital, but one of our campuses, you have a police station, a school, a library, a housing complex, and our hospital. So this geothermal system would provide energy to all of those areas. Geothermal, it's a constant energy source, which was a big win, but it would hopefully be able to reduce the bills, but also add a layer of resiliency for that site. And I provide that as an example. Is it's something that it hasn't been implemented yet. Obviously, there's a long process, but we had started that process by lending our voice to the project, because I think when organizations in the community hear that this is something that we're supporting because of whether it's a clean energy piece, resiliency piece, all these different angles, it helps them want to get involved and help remove some barriers. So that's something that we've been working on. We've been having some meetings, but we're also going to be advocating to the state um, to help us get this into reality. So that was an example that I wanted to give from an infrastructure level. But I think another big piece is around supply chain. Um, you know, really, COVID, I think, was the big eye opener in terms of how a supply chain could be disrupted from many different angles. But with COVID, we really saw a lot of gaps that will help. What the lessons that we learned from that, I believe, will really help us um, moving forward from whether there's a climate, whether extreme weather, or any of these various events. But one of the pieces was that we have stood up our own distribution center central to our network. So we're able to look ahead and in certain cases, whether stock up on some critical emergency supplies, whether it be masks, gloves, you name all the different areas that we probably experienced shortages with during COVID. But there's a component of bringing that, stockpiling some materials and getting ahead of various situations. The other critical piece of this was really um, bringing as much as we could from the community, looking to partner with community suppliers. When you're relying on a global supply chain at certain times, there are many extreme weather events that, the impacts are out of your hands in terms of being able to get supplies from around the world, whether it's something like a COVID. And, we've really expanded the definition because for a while it was just focused on, from a climate resiliency standpoint. But now we really have this really just resiliency umbrella that has all of the different aspects, because addressing one of them helps support all of the others. So we have that distribution facility that, for all of our hospitals, the central site. We did not have that prior to COVID. So that was an area that we got to experience a lot of benefits from that resiliency standpoint. And then, I think something that I've found interesting is it seems that most of the IV solution manufacturing facilities are in the eye of the hurricanes that have been hit. So during numerous previous hurricanes that have happened, and especially the most recent few, we dealt with IV shortages. And similar to during COVID, when your clinical team gets creative in how they deliver care during these circumstances, you know, there's a number of different measures that were put into place in addressing these IV solution pieces that I think that whether it was looking at, you know, not having to change IV bags every 24 hours, delivering medications, if there was an oral medication, instead of doing it with an IV counterpart, where clinically feasible, using oral electrolytes and hydration wherever clinically feasible. And there's a list of measures that were put into place that I think that some of them are obviously, and I'm not a clinician, but some of them are not conducive to clinical care, and it's done out of necessity from the times. But what we found was, in looking at that list of measures that were being implemented when we have these shortages, it's you know what of those are we able to keep moving forward to be able to conserve supplies anyway? And it's definitely not all of them, because, like I said, first and foremost, it's about delivering high quality clinical care. But we did find that there were some of those measures that we were able to keep in place, to just be a good steward anyway and be able to conserve resources. And some of it, was of benefit to um, the clinical teams, whether it was being able to deliver care more efficiently, not having to go back and forth for various supplies as often. But I encourage all health systems to look at that, because it's also something that, when these extreme weather events hit, and it's not a question of whether they are going to hit, we know that they're going to happen. It's, we've documented these best practices beforehand and are ready to really implement them at the flip of a switch. So that's a big area that I think, from at least from my experiences, COVID really helped galvanize us. But we've also been keeping a record of all these different areas and doing them. So, you know, at the end of the day, the key part is collaboration, and no institution can say, we don't have money, we can't collaboration. It's talking to the frontline team members, talking to your suppliers, getting ahead of it. Just another example is with the tariffs, that I wanted to hit. We bulk purchased a number of supplies that we knew were going to get hit by the tariffs, and we have them in our warehouse being prepared. So that helps really from a financial resiliency standpoint. Because like I said, we don't just picture resiliency in just the climate area, but looking at the overall picture. But it's about having those partnerships. So we partnered with our clinicians around the different shortages, and came up to ways of how we can conserve supplies. We partnered with suppliers, but then we've really partnered with our community members and areas like our local utilities. And that's been crucial. And you don't have to have an idea at first. It can just be simply having that conversation, because the last thing that any health system would want is to meet some of these partners when a crisis is hitting. You want to have those established relationships beforehand. And that's something that's really helped us all along in driving these measures forward. So hopefully, just wanted to give a little bit of a snapshot of kind of just some of the different ways that we view resiliency at Hackensack Meridian Health, and now pass it on, where you're going to hear more about the facilities areas with New York Health and Hospitals.
All right. Well, thank you, Kyle, for that amazing presentation. Next, we'll hear from Aminul from New York City Health and Hospitals. Aminul, please feel free to get started.
Sure. Thank you all for having me here today. So what I want to go through is more of the recent incidents that we've had with health and hospitals, particularly with Hurricane Ida. What I have here on screen right now, this is a storm image of Hurricane Ida as it passed over the New York City area. And something that I want you guys to note is to note how, as it approaches New York City, you have these sudden bursts of red. These reds are significant storm cells that are just passing over. And with these cells forming in such a short amount of time, unfortunately, that gives our facilities a limited amount of time to react. And in the next slide, you'll see sort of the damages that came about from that intense rainstorm. So we can head on to the next slide. So what you see here is sort of the results of these heavy rainstorm events. Hurricane Ida passed through, it dumped up to 4 inches of rain per hour on the New York City area. And this just simply overwhelmed the systems that were in place. So you see in that video in there how it overwhelms and damages pipes, and because it damaged pipes, you cannot have proper drainage. So it leads to additional damage, such as roadways collapsing, with sinkholes forming, flooding waters, taking over parking lots, getting into basements, elevators, just causing damages and interrupting services throughout multiple facilities in New York. And that was one of the things that I do think sort of caught us a bit off guard, was the fact that you couldn't just pinpoint it into a singular area. It was spread throughout the city, so that in reality, no one was safe from these kind of destructive forces. And of course, I do have to give praise to our engineering team for being calm in these situations, for reacting to these kind of events. But we want to make sure, especially at health, with the communities that we serve, that we don't want our teams to react to such. We want them to be prepared, so that way when the next event happens, which as climate change continues to get worse, and it will inevitably happen. We saw it happen already again in 2023 with the remnants of Ophelia, that we want to be prepared for that. And when we head to the next slide, there we can see our defensive measures. So these are sort of the localized measures that we're trying to implement in our facilities to help protect. So there's multiple things that are happening. We're installing pumps in our facilities to make sure that we pump out these elevators in these basements to get the water out so we can get reactivated faster. We want to put in detention tanks to capture that storm water. So that way it helps our agency colleagues at the Department of Environmental Protection, so that way their stormwater system doesn't get overwhelmed, and that it helps them out, but also helps us out because this water isn't being flowed back into our facilities. And then you have what we have here on screen, which is a self-rising floodgate. Now, these are very significant systems in that it helps us react better against these sudden storms. After all, these do not require personnel to come in, actually activate them. They will react against the storm water that comes in. And you can see within the video that it is rising to the task at hand. So having these measures in place are all really designed to make sure that we are better prepared against these kinds of storms, and that health and hospitals continues to remain functioning. But then this also led to a question, because we were sort of caught off guard. We were focused very much, especially after Hurricane Sandy, against these coastal storm events. But now we have this new threat of rain events. So now not only do we have these rain events, what other threats do we have to face? So on our next slide there, you'll see that our colleagues in OFD, or our facility colleagues, we wanted to understand what are these risks that we are facing beyond just coastal and rainstorm. What else? So we work with our facilities, our colleagues, our folks in emergency management, as well as our clinical staff, to really help identify the threats that our facilities face, which included rainfall, heat, and wind. And just look at that, not just on a base facility level, but to also look at that beyond, within the community, within the systems that are interacting, to make sure that if another event happens of any of this sort, that we are going to be better prepared, that we can identify the threats that we are going to face, the scale that these threats are going to present to us, and what we can do to protect ourselves against that. And that's what ultimately resulted in creation of the Health and Hospital Climate Resiliency Plan, which I think does a good job of identifying all of those and helps us better understand what we need to do and be prepared for that future. So thank you for that. We'll hand it off to Rachelle.
All right, thank you for sharing that story, Aminul. Lastly, we'll hear from Rachelle from CommonSpirit Health. Rachelle, the stage is yours.
Thank you, Dr. Levin, and thank you, Kyle and Aminul. You complete me. Thank you to AMA for the opportunity to share with you CommonSpirit's story and our commitment to healing and resilience in the communities we serve. In the short time we have together, I really thought carefully about how I wanted to make our time meaningful and memorable, not so much through slides, but by way of storytelling, including sharing with you my lived experience, where I was and where I am today, in the hope that it will honor our time together and the way in which you are creating your own resilience story. At the age of 5, I became an immigrant to this country. We left the Philippines in 1972. At that time, the current politics, socioeconomic conditions, as well as healthcare needs for my sister who had polio were certainly drivers. It has only been recently did I remember an experience I had when I was a child. At the start of a panel presentation I was a part of earlier this year, there was a memory that came over me like a rush, this realization that I too was also a climate migrant. As a young child, there are very few memories that stay with you. And at this moment, I remembered a snapshot of me wading through a flood in our home and looking up at Dad, who was trying to move a small refrigerator up a narrow set of stairs. I came from humble beginnings. Some would say we were poor, others perhaps blessed. We didn't have much in terms of things, but that didn't matter as much as knowing I was loved. If there's a general descriptive about Filipino families you can take away from this, rich, poor, and everything in between, to us, food is love language. So I could only imagine what that refrigerator meant to my dad. More than a half century later, I understand better now the punctuation of that moment, the purpose in which it's revealing itself to me now. First imprints of preservation and prioritization, that sense of protection and urgency to act showed up for me at a very early age. There are questions I'd like to ask that child. Why was my vantage point not from higher ground, but from the bottom where my feet were in the rising water? I don't remember much of anything else about this story. Was I panicked? Did I think Dad a hero? Was he panicked? What was so important about getting that refrigerator upstairs? Did extreme weather conditions factor in my parents' decision to leave everything that they've ever known in their homeland country to seek life elsewhere? Not that they were climate and health advocates as I am now today, but they clearly experienced a force that was bigger than themselves, a threat to our family and well-being. That was enough for them to muster courage and action. Given what I know now about the many lives taken by typhoons and floods, especially in one of the most disaster-prone countries in the world, you just need to Google Philippines and climate change, where increased frequency and severity of natural disasters, sea level rise, extreme rainfall, resource shortages, and environmental degradation continue to occur and take lives. I ask myself, would I even be alive today with you? Resiliency planning requires that you see yourself in the story. It has to be that personal. There will be many things that you are going to be known for, but be known to yourself that you are part of this story. So I want to frame for you a little bit that, it's true that resilience planning is about preservation and prioritization. It is also an act of love. In healthcare, we know that preservation is about safeguarding from loss and holding on to that which we place, which places us in our story and our ability to deliver healthcare and all that comes with that. Standing up our buildings, keeping our lights on and our doors open, having critical supplies and materials needed, protecting and developing our workforce, partners, and relationships. But it is above all caring for our patients and the communities we serve. We know that we have to factor the water around our feet in which we now stand, the disturbances, the disasters, and climate impacts that threaten or put at grave risk the promise we make to our communities day in and day out. And they rely on us to be there for them during their most critical time and in their tomorrows. So while preservation efforts can, certainly contribute to resiliency, resilience strategies specifically require ensuring our healing mission and practices can hold water for the vision we are creating for the future. For CommonSpirit Health, Hello Human Kindness, you may have heard about Hello Human Kindness, is not just our brand. It is at the heart of our resilience planning. We believe human kindness is at the root of all healing. It's a simple belief that while medicine has the ability to cure, it's our shared humanity and the pursuit of the common good that holds the power to heal people and planet. So a little bit about what we're doing. For CommonSpirit, we've been on a journey towards transformation that has always included caring for our common home as we remain steadfast to delivering on our healing mission. Caring for Earth is part of caring for the people who live here. Healing for our communities happens not only within hospital walls, but arguably more so out in the communities we serve. Our resilience strategies are embedded in who we are and what we do. As we work to advance health justice, we know that climate impacts are a health equity issue. For the climate crisis we are in now, especially, we know that it impacts disproportionately those already vulnerable, and many more of us are becoming increasingly vulnerable. In 2019, CommonSpirit announced to the world our net zero goal in Glasgow at the United Nations Climate Conference. The following year, we released our climate action plan on Earth Day. Our CAP has 3 pillars: buildings and energy, supply chain, and last but not least, community resilience, which I lead. These pillars sit atop key enablers: data gathering and reporting, finance, partnerships, and advocacy. In this body of work, we have been focusing on key areas related to patient health, community health, emergency and disaster preparedness, and public policy and shareholder advocacy initiatives. I want to invite you to listen not only for the questions that surfaced for us, but how we come to them, and the hope that you wade through your own questions and take away ideas and tools to develop and enhance your own strategies and practices. So some of the things, of course, that we asked ourselves across our 24-state footprint: what climate and social vulnerabilities are our patients facing? What's the water around our feet, literally and figuratively? What is this time for us? How do our communities identify their needs, and how do we implement community strategies along with internal and external stakeholders to address unmet needs and concerns that they identify? Are they panicked? What's their level of awareness as well as actual experiences about climate impacts? Are we listening? Can we create opportunities to cultivate common ground, to surface and plan for solutions? How do we get up the stairway to higher ground? Who are the heroines and heroes of our story, the champions for this work? Must hospitals do it all, or isn't the better approach to partner and carry the burden with others? I remember someone was helping Dad and me getting out of the way, at least for the time being. What community resources are available now, and in the possibilities we could create for the future? How do we address the immediate crisis? How do we smartly plan for mitigation and adaptation going forward? My child self would ask, is it just about refrigerators? What are the measures for our work, and how do we evaluate for continuous improvement and sustained momentum? I can only imagine the satisfaction of Dad getting the refrigerator up those stairs. But what else was accomplished that day for our story to be complete? What does our tomorrow look like? We cannot manage or change what we can't measure. Central to and foremost in our resilient work is, how do we lift up our humanity and deepen our kindness practices? There's more to CommonSpirit's resilience story. And as I mentioned earlier, I oversee our climate resilient communities pillar. And I just want to lift up just a few examples of what we've been doing. We've been developing a geomap to understand both our climate vulnerabilities at the intersect of social and economic vulnerabilities. We partnered with our Lloyd H. Dean Institute for Human Kindness and Health Justice to help us with resources, to get an intern from Johns Hopkins to gather the data that we needed from publicly available resources. So we wanted to get this big picture to help direct our focus and to prioritize and steward our resources. Meanwhile, the Lloyd H. Dean Institute has developed the Common Good Academy, where we bring a cohort of our employees and clinicians together to really understand climate as a health equity and justice issue. And so we're working on an expanded webinar series for more broader and clinician education and engagement. And I can't not be excited enough about what we're doing with our CHNAs, our Community Health Needs Assessment. Our focus also was directed to what we can call low-hanging fruits. What has been exciting is the information that we're gathering from our direct engagement with the community. Our community health leaders across our ministry are currently working with our new 3-year cycle of CHNAs, and they're including climate-related questions to surveys, interviews, and focus groups, as well as quantitative data on climate risks and health to really create this awareness about local climate conditions. So like Kyle has been sharing, you know, it's about looking at what we're already doing and how can we beef it up, make it more sexier, make it more meaningful and relevant today, right? So CHNAs is a vehicle for that. And quite honestly, it doesn't matter what you call your resilience plan. It's not quite low, but it's real. We have emergency operations plans that hospitals are required to do. And so in June 2022, when CommonSpirit signed the health sector climate pledge, as part of that pledge, we developed a guide that was designed for our emergency and disaster preparedness leaders to help them more closely look at how they do their risk assessments and hazard vulnerability analysis. And this guide really is about promoting an organization-wide HVA process. It takes into account a community-wide view of risks, threats, and hazards. And really, it's about sharing the work with key partners as a means to identify potential areas of collaboration to mitigate threats. And I can't say enough about how dynamic that process is and how rich it is, because it's helped us to really look at, how is it that we can better plan for local residents seeking food, shelter, and safety during extreme weather events. And also, how do we look at how the community can better access our hospitals to account for the increased community demand and surge in medical attention. So these are just some of the ways, and I know that our hospital, for example, too, in downtown Los Angeles, I'm so proud of the work that has been done there with California Hospital Medical Center. I believe they were actually one of the first to develop a hospital-wide heat drill, and they learned through that exercise in real time, the significance and importance of really looking at infrastructure upgrades that we needed to make with our HVAC systems, for example. Air conditioning needed to be added to the elevator and mechanical rooms on the roofs of our buildings because we found that they were not working very well under extreme heat. And so this exercise also allowed us to reach out to develop stronger collaborations with the City of LA Chief Health Officer, and we became quite the engaged leader, if you will, with the Los Angeles Regional Collaborative for Climate and Sustainability that really brought the various different organizations, government, et cetera, around the table. And really, again, to echo what Kyle was saying, I think, this exercise allowed us to be better prepared for COVID, for power outages, for the LA fires that have been occurring here and that continue to happen. And so I want to stop here just in the interest of time. I can tell you more, and yet I can also, in humility, tell you that we are still at the start of our journey, but we are so excited because the best is yet to come, and we are certainly wanting to see ourselves in this resilience story that's not just about our story, but our story with you. And so I'll end by lifting a quote from Dr. Daniel Taylor. And if you know anything about Catholic healthcare systems, they have to have a reflection. And so I will end by saying, we live in stories the way fish live in water, breathing them in and out, buoyed up by them, taking from them our sustenance, but rarely conscious of this element in which we exist. We are born into stories. They nurture and guide us through life. They help us know how to die. Stories make it possible for us to be human. And so, Dr. Levin, on behalf of CommonSpirit and the child self that still stays with me, I want to thank you for the honor of allowing us to be part of your story today. So thank you all. Dr. Levin?
Wow, thank you. Thank you, Rachelle, and thank you to all of our presenters for providing such great stories with valuable insights and lessons learned. I'm sure there are questions, so let's get to those now. We'll start with some of the questions that our audience submitted when they registered for the event, but I also encourage anyone watching the chat, watching to join the chat and ask questions there. So we'll get to as many of them as we can. The first one is for Aminul. Can you speak to the IAQ, the indoor air quality measuring systems that the health systems should be implementing now for both indoor and outdoor air challenges we face in the future?
Sure. So there are two parts to that. So when we're talking about the external air quality, a couple years ago, we had that incident in New York City where we had those Canadian wildfire smokes come over and turn the skies of New York into that dark, deep orange that just captured everyone's attentions for those couple of days. So a lot of our systems already do have HEPA filters and other HEPA filters, UV lights already on the air intakes to help filter out a lot of that smoke. But of course, there's only so much that they can do. So there does need to be some thought given to how we see those threats and address them. Are they common enough where we need to update these HEPA filters to the next MERV level? As for indoor air quality, I'm going to be a little more reference towards viral because that's what we were dealing with a lot more back in 2020 was that spread of COVID, where at that time we're looking at airflow, trying to figure out, we did implement some systems, but because of the emergency nature that we were only able to implement them in certain areas like emergency and operating rooms. But there are definitely thoughts of as we rebuild spaces to do it in such a way where if there is an expectation of a patient with a contagion, that we are able to keep that isolated to that area and prevent that spread from going into the remainder of the hospital, since that is something that was unfortunately happening during COVID times.
Okay. It's very interesting. Kyle, I have a question for you. What is the current guidance around discarding or reprocessing sterile instruments with an extreme heat event, such as like a failure of cooling towers?
Um, so I guess there's a couple different ways to take that question. I don't have the policy on hand of what that would be. You know, that our peri-op sterile processing infection control team would keep that. But I can speak to the frame of reference in terms of, you know, when there's shortages of supplies that we may have been using single use prior. We did in certain instances convert over to reprocess so that we were able to have instruments on hand to utilize. But in most cases with the reprocessing, we partner with suppliers that they reprocess the devices outside of the hospital. They take it apart, sterilization, clean it, and bring it back together. So, you know, I'm not too familiar with the internal guidelines because so many different products have different, you know, different type ways of being sterilized down in central processing. So haven't, you know, dealt that much into the weeds in a while, but I could find that out and provide it to somebody.
And just expanding on that, since we are seeing a lot of extreme heat events, as far as medications and how we protect, access to our medications, including our IV medications, what are your thoughts on ways that other groups can work to really improve what they're doing now?
You know, I think one of the big areas that we've just found is, we have all of these, but like whether it be those extreme weather events, the COVIDs, the different, crises that pop up, people do a great job at improvising in the moment, but there's a couple different areas where that we could improve. I think is sharing those best practices. A lot of times people get nervous in talking about, how they've changed delivering the IV solutions because, they get nervous of having to talk publicly about the fact that, hey, we were short on, this medication, this IV solution. We always like to tell the perfect, oh, we were perfect here, we're perfect there, but really being vulnerable and sharing those best practices so that it benefits everybody. And I know within healthcare, none of us would look at another person and say, oh, like you guys clearly weren't doing. No, it happens. So sharing that information and documenting it so that when the next occurrence happens, we're not always creating things from scratch. Um, but also, I think just building a culture, trying to build that culture to get creative, because at the end of the day, we can have all of these plans for how to deal with all of these instances. But like we saw during COVID, you improvise, you learn on the fly. You really learn the best when your back's against the wall and you have to figure it out because there's no other option. But really sharing the successes, the failures, and having those open conversations is something that I think all health systems can get better at doing.
Um, I've got another question for Rachelle this time. Are there tools or guidelines for risk stratifying patients based on comorbidities and medications?
I certainly am not able to answer that question. I would want to turn that over to our clinicians to answer that. But I do know the efforts that we're taking to try to really look at, I know that the next steps, with our geomapping and prioritization, I know that we're going to look at specific vulnerable populations and some of the things that they're experiencing, such that we're going to look at climate action strategies that will help with their health and healing. So, I mean, I know that we've talked about, those with respiratory illnesses, those with asthma. What is it that we can do to alert them when it's a bad pollution day, right? What is it that we can do to look at inhalers in such a way that, it's better for the environment? So these are, I think, part of the question that is being asked here. But I know that our clinicians would probably be better suited to answer that in more medical terms. So happy to provide a more thorough question for that individual who asked. But thank you for the question. That's important.
And it actually broaches into a larger area for each of you. I think the question that I would ask is, what are your biggest takeaways most recently from your experiences with dealing with climate events and your own health systems and having to work with them? What maybe can we offer to other health systems as they're looking to learn from this webinar about perhaps things they hadn't thought about or they hadn't gone through yet?
I think, at least from the health and hospitals perspective, one of the tricky things is as we're looking into these new threats and these issues, one that's come up is how do we react, sort of similar to what was the question before about air quality, and how do we alert patients to be prepared for that? Along with issues with power outages, how do we inform our patients to be better prepared? You have patients who are on equipment. And an interesting issue that has popped up is the question of maintaining that HIPAA compliance, because you have that patient information that needs to be protected. It's federal law. You do not mess with the feds on that rule by any means. So how do we best try to inform these patients to let them be aware of it without violating that protocol? It's a question that admittedly, we're still struggling with, but it's definitely something that needs to be watched out for. especially if we want to try to alert these patients to be better prepared.
You know, from our angle, I think one of the biggest areas is having a lot more proactive, being a lot more proactive with our supplier partners. You know, as we've talked here about the impacts of climate and resiliency in our own operations, you know, just because the region or area that you live in hasn't been impacted, you know, if it hasn't been impacted as many times, the number of events that are happening, whether it be in Puerto Rico and these different parts of the world where a lot of our crucial supplies are being manufactured, um, you know, really having plans in place with them. And I think it's going to vary, especially for, you know, obviously we're a larger health system. I mean, all three of our systems, hospitals on this call are larger. You know, I think it's for if you're at a rural hospital or a different hospital where you may not have that purchasing power to demand to the supplier, hey, we need, you know, this ahead of time. Really having those plans and working with the various, you know, whether it be your local hospital association or even turning to groups like this to help bring together partners and have proactive conversations, especially with the external suppliers that you know, are being impacted. Because I can tell 4 events that the last 4 major hurricane events, we've all been impacted with IV solutions here. And those hurricanes did not happen in New Jersey; they happened in other parts of the country. So that's been something that was our big takeaway.
I think for me, just to reflect back on comments that I've made already, I think that it is so important to invest some time in education and training of all of our employees because we do need leadership, and this issue does not fall under one department. If we really look at what healthcare's purpose is in terms of, healing, it really is the responsibility of all of us, to see how we can create resilient strategies in all the places where we sit in healthcare, right? There is no one individual in my mind that isn't touched by this issue and isn't touched by the water around their feet on this issue. And so it's really about, reflecting on what is it that I'm doing, whether I'm sitting in the basement of the hospital, in my hands, touching patients, at the registration desk, folks in finance, whoever we are in the healthcare spectrum, we've got some work to do. And I think education and allowing ourselves to sit at table, to create that table for dialogue and for dynamic learning, I think is what's going to get us there. Because first and foremost, we want to do this. And we're going to really need to understand that for ourselves.
There's a question from one of our viewers who want to know if you all could address if you have disaster preparedness plans in place for persons in catchment areas who may be more vulnerable, for example, older individuals or people with comorbidities or device-dependent individuals. And are these general plans? Are they for all disasters, or are they for specific types of disasters?
I can give it a shot with that. So, you know, our plans typically it's going to vary. You know, we have that overarching, you know, emergency management plan. That being said, there's different types of protocols that could go into place. Whether, you know, say, you know, there's been like a breach of with IT, hacking is a big thing now. Obviously, you're going to have different emergency plans in place for that than if, a hurricane hits or something like that. So, in terms of reaching out, I'm sensing some of that question might be how do we reach out into the community to the various populations that could be disproportionately impacted with certain comorbidities. A lot of it's really relying on our community partners, but as well as, our community outreach and engagement team has, we have great relationships with specific community partners, and some of those community partners are more focused, may focus only on like asthma or different areas. So we rely really, like I said before, that proactive, relationships we have with those teams, that they help with that outreach into the community as well as us. But it can vary, obviously, in many different ways, depending upon what happens. But no matter what, we always have that overarching level of preparedness with any emergency, kind of the similar protocols go in place, but yeah, it changes in terms of sometimes which community partners we may reach out to.
Yeah, and I think that was the impetus for our community resilience guide. It already is asking for that level of assessment, in terms of how are hazards going to impact patients and community, and how are you going to deal with that. But it's really about, again, lifting up what is our part to do and what is the part of our community partners to do, and how is it that we can coordinate and collaborate with one another to really develop the most robust local plans, right? And really, it's about those local facilities, local hospitals, leading the way on that. And it's going to vary from place to place. And it should, because it needs to be that specific, and it needs to really harness and leverage the local resources that are around.
And for us in the New York City area, we're lucky that we have such a big local government infrastructure that's in place, so that we do work with, so that we are, while we do have our part to do, we are in coordination with our colleagues over at New York City Emergency Management, who help us make sure we stay in contact with Con Edison, the NYPD, FDNY, to really make sure that if there is something that is happening and there is a evacuation of a lot of people, that we're just not all of a sudden surprised when 20 ambulances show up at our door, that we are better prepared for that. So it's really, as I've been saying, knowing our part and playing our role in providing that healthcare for the community.
And then the last question, just I don't know if you can touch on this briefly, but are there examples of projects or resilience efforts that address multiple threats?
I would say we do have some projects that are trying to address both the coastal, the rainfall, and that heat. In fact, New York City, where we're 70% asphalt and concrete. We do have a good amount of park space, but it's still a city that is just generating all this heat. And when you have that heat island effect, it just makes these summer heats just so much more worse. So as we're implementing some of these flood mitigation measures, we are looking into trying to add more green space, more greenery to help mitigate these efforts, whether they are just by adding more landscaping, putting bioswales, or even installing green roofs on top of our buildings, which do help capture more of that rainfall, but also reduce that heat island effect. If we're able to address multiple of these issues, then I think we do try to work to make that happen.
Thank you so much. I want to thank you again, to our amazing panel, and to everyone joining us for taking the time to provide insights into how their health systems are approaching climate resilience, and for the questions that our audience supplied. We appreciate the important work that you do and are grateful to you that you were able to be here to share your expertise on this topic. I also want to extend my gratitude to our audience. Thank you for your interest in this topic and for spending your valuable time with us today. As I mentioned at the beginning of the webinar, this is the second in a three-part webinar series on climate change. Mark your calendars as the next and final webinar will take place on Thursday, August 21st at 11 a.m. Central Time, noon Eastern Time, where we will discuss how healthcare organizations can reduce their own greenhouse gas emissions. A link to register for that webinar will be shared in the chat and sent out to all of today's attendees. All webinars that are part of the series are being recorded and will be available on AMA's EdHub website, the link for which will be shared in the chat. CME is available for today's webinar. Just make sure you're signed into your free AMA EdHub account and click on Take Quiz. Thank you for joining us today. We look forward to seeing you at our future AMA educational webinars.